Coming up today, brain surgery without an incision. Instead of a scalpel, doctors use sound, a remarkable procedure that can cure tremors. See the night and day difference it's making, giving patients their lives back. Good morning, I'm Jessica Lovell. Welcome to the Morning Medical Update. Tremors caused one woman's hands to shake so badly that she had to give up her very favorite activity until she heard about an innovative procedure that could make one of her hands steady again. Janine Kiesling introduces us.
I'm doing a tray with my roses.
In her quaint Fayetteville home, Carlene Kirkwood loves nothing more than to spend her days painting. It's been her passion for more than 40 years.
I have 4 boys, and when we first moved to Fayetteville, they were in school and I wanted something to do, and so I went to a class and I've been at it ever since.
So good, she even started teaching it. But in 2018, Carlene noticed her hand started to shake. She had developed tremors. Ultimately, tremors not only made painting impossible for Carlene, but even many everyday tasks.
I got to where I couldn't hold a cup. I couldn't hold a spoon. If I was cooking, I'd drop things. And so it got bad. One doctor said, you know, this is what they call an old age tremor.
She felt so sad, and over time that feeling began sinking deeper into despair.
I was just mad. I'd get mad because I can't accomplish anything.
But then in 2021, her local doctor in Fayetteville told Carlene there might be hope. And that hope was 240 miles away at the University of Kansas Health System.
He said, there's a procedure in Kansas City. Well, that's all it took. I was on the internet that night.
Ultimately, she was undergoing a procedure that would give her life back. Focused ultrasound. It took less than 3.5 hours, and she says it completely stopped the tremors on the right side of her body.
This side of me shakes. This side doesn't.
It was so easy and painless, Carlene plans to return to the health system to fix her other hand as soon as possible. But until then, she's back to painting every day, loving and living the life she thought she left behind.
And I would recommend anybody getting it. It's not worth putting up here that when you can have something done. But then you have to stop and think, this has just come into effect 5 or 6 years ago. Medical is marvelous.
And we are so happy to have Carlene Kirkwood on the phone with us from Arkansas. Carlene, can you hear us okay?
Yes.
Well, I mentioned that this was your favorite activity. This looks like way more than an activity. This is a true passion, and your artwork is really, truly amazing.
Well, it's something I enjoy, and I love to do it, and I love to teach. So.
Well, it's a joy to hear your story, and we appreciate you sharing your story with us, and we're going to talk with you here in just a moment. I want to introduce some of your care team. We've got Dr. Rajesh Pawar. He is a neurologist and movement disorder specialist here at the health system. He is also the director of the Parkinson's Disease and Movement Disorder Division here at the health system. Always good to see you.
Thank you. Thank you for having me.
He works closely with Dr. Michael Kinsman across from me this morning. He's a neurosurgeon here at the health system who has done many of these focused ultrasound procedures. Thank you both for joining us.
Thank you.
So, Carlene, when your tremors were at their very worst, how were you getting by?
I read. I could read a book. I had a form that I put the book in, and I could just turn the pages and it wouldn't shake. But and I tried to paint, but I just couldn't manage it.
Yeah, that would be really frustrating. Your doctors tell you about this focused ultrasound here at the health system. You came here for the procedure. We're looking at some video of another patient going through the same procedure that you went through. You had to shave your head. Then you spent some time in an MRI machine. What was your experience like during the procedure? What can you share?
It was so easy. Everyone was helpful. They told you what you were supposed to do. And like I said, it's only 3.5 hours. At the end of the time, your hand didn't shake.
So you told us there was a side effect after the procedure. You had some balance issues. How long did those last for you?
Well, to me, it was real upsetting for about the first week, and then it leveled out. And after about a month, the balance issues just disappeared.
So we want to show some video of your two hands. Now this is you. We're looking at this video. One shakes, one is steady. We know you're planning on having focused ultrasound done again for the left hand, but even with just that one steady hand, how much of a difference has it made in your life?
Oh, a total difference. I could hold a spoon and a cup. I could go out to a restaurant again, and I could paint. I could do everything that I did before.
Well, it's truly remarkable, and we're so glad you're back to teaching and painting and doing what you love. Carlene, before we let you go this morning, is there anything else you want to share with us or say?
It's just so easy, and the people at KU they're just fantastic. They're helpful, and they're always smiling, and I'm gonna in January get the left hand done.
Well, we will catch up with you then. Until then, keep painting with that right hand and stay well, friend. Thank you.
Thank you.
All right, doctors. So Carlene's outcome, amazing, because you could visually see this. And focused ultrasound technique itself, as we know, is fascinating. So Dr. Kinsman, just explain to us, you use sound waves to heat up a part of the brain. So tell us exactly what you're doing and why that works.
Yeah, so in the video, you could see that there was, the patient was laid down on the MRI table, and there's a helmet that has, you can see in this video, the helmet itself has ultrasound transducers, 1,024 of them. And if you can imagine, all that sound energy focused on one point where all those sound waves intersect, it produces a lot of energy there, and it can heat up the tissue. So there's a lot of work that we do in terms of planning the procedure, but ultimately the goal is to have all those waves intersect at that specific spot to try to help that tremor.
So that specific spot is where those tremors are affected. Yeah. 1,024?
Yep, 1,024.
Okay, very precise. So you shared some MRI scans of Carlene's brain. Show us what we're seeing here.
Yeah, so circled in red is actually the after effects, kind of the lesion that we produce in an area of the brain called the VIM. And that is kind of the target for this procedure itself.
So how does a burn to the brain stop tremors?
Yeah, so one way to think about it is that it impacts or kind of disrupts some of those abnormal signals that pass through that portion of the brain, through that portion of the thalamus, and calms down those tremors.
So from a patient perspective, it sounds better than brain surgery. Brain surgery sounds really drastic. But from a surgical perspective, is focused ultrasound easier to perform or just different?
It's just different. So most of our time, instead of making incisions, closing incisions, placing electrodes, we're spending a lot more time with the patient, getting them out of the MRI magnet itself, interacting with them, testing them, making sure their drawings, their movements are smoother. And then also a lot of time spent on the console, making adjustments to how much energy we're delivering, how much time we're delivering that energy in order to get a specific temperature at the center where we're actually focusing that energy.
So Dr. Pawa, educate us. Where did this come from? How has this focused ultrasound evolved?
Right, so this really started in Israel. The company in Israel started looking at that, and the idea behind it, like Dr. Kinsman explained, is trying to bring all the ultrasound waves to one spot in the brain where you can we know where the tremor is affected. So if we can disrupt that pathway of tremor, we can help the tremor. So that was basically the goal, is using this technology, sending ultrasound waves through the skull into the small area of the brain and causing the lesion.
So is the technology and procedure new, or just how we're using it?
Actually burning the brain, that's the thalamotomy, causing lesions, has been around for over 50 years. So we used to do that a long time ago, about 30 years ago. After that, it evolved into deep brain stimulation, where we are not creating a lesion, we are putting an electrode in that part of the brain, hooking it to like a pacemaker device, and actually using electrical currents to break that pathway and help with the tremor. But with DBS, which we still do, you need hardware, you need programming. So there are advantages of both procedures, DBS and focused ultrasound. It really comes down to the patient, what they would prefer to have done.
All right, so Dr. Powell, we have a right and a left side. So why only the right side?
So this is relatively new procedure. So when it was approved by the FDA, it was only approved for one side. When it was approved for the one side, usually the patients use their dominant hand, because most of the things we do is with our dominant hand. So that's how it was done on one side. Recently, FDA did approve both sides, and we have had a few patients who have had two-sided surgeries.
So you can get them both done at the same time now, or you're shaking your head no. Why is that?
No, and it's partly historical, partly because of the side effect that she had discussed. So the balance is kind of a challenge sometimes. So if you can imagine, if she had a little bit of balance difficulties with just one side done, if you disrupt the other side, she's going to definitely have some balance difficulties. And so it's a safety thing. It's a safety, but then also a technical aspect to it too. Because with every time, you know, we call it sonications when we deliver that sound energy. So with every sonication, our system becomes less efficient. So we have to introduce more energy to get the same level of heating at the spot. So you kind of run out of time. So if we were going to do one side, it's going to be super hard to do the other side, almost impossible.
Makes sense. So what kind of patient is focused ultrasound good for? And if that patient isn't right for focused ultrasound, what are the other treatment options for tremors?
Right. So right now, when a patient has tremors, does not necessarily mean that we need to treat it, because some people have very little tremor. They can get by on their daily life without any interruptions in their activity. Some people only have tremor when they're on doing certain tasks, like being on television and talking. So they may take medications before their show and they're fine. And usually the medication is like a beta blocker. Alcohol is actually the best treatment for tremor. So people who are going on dates at times have a glass of wine before they go out on a date, and that also helps the tremor. Other medications, one is an old seizure medication called primidone. There's another seizure medication called topiramate. We do use those medicines, but they're not very effective. In fact, with all the medications we have, over 50% of our patients continue to have tremor that interferes with their daily life. And those are the patients where we look at other options, whether it is using now we have a peripheral nerve stimulator, which is like a watch that you put it on your wrist and it provides electrical currents that go back in the brain and are helpful for the tremors. We have the surgical procedures like we talked about, focused ultrasound, deep brain stimulation, are the other techniques we use.
Okay, I have to go back to your dating advice for going out and having a glass of wine. So are you telling me that that's something that people can do to just quell it for a short amount of time? Is that actual medical advice, or is this just well-known information?
This is well-known information.
Okay.
In fact, the first thing we ask our essential tremor patients is if they drink alcohol, does the tremor get better with alcohol?
Interesting. Interesting. Okay, well, something else that you test is the handwriting, their ability to write their name initially after they have this procedure. And you can see in the video the results are pretty much immediate. So kind of show us, so from one side to the other, we're seeing photos of like right before they do it and then right after they do it?
So the one on the far left is typically a drawing that we have after we've put the head frame on, put the membrane on, we have them do a drawing on a clipboard before they even go into the MRI suite itself. And then the second one is typically what we call a verification sonication. So after we've delivered enough energy to disrupt those pathways, but just it's not a permanent lesion. So it's a reversible situation. The one on the far right is afterwards, after they've gone through the whole process.
And so this is something that tells you a lot about how this is working in the exact moment.
Correct.
So do you show this to the patients pretty quickly? When do they get to see this and see those
immediately,
effects?
really. So as we're doing it, but then also what I tend to do is I tend to bring those sheets with me when I go talk to the families afterwards, so they can see the progression. So it's a little bit of show and share. So we get to go through the whole process, and they can see the progression.
And that's got to feel pretty good. Pretty emotional, though, with these patients who have not been able to do things like hold a spoon up to their mouth or paint. In Carlene's case, what's that like? Being able to walk through that journey with them, Dr. Pawa?
It's amazing because, you know, these are simple things that the patients are struggling with, whether it's eating, whether it's drinking, or it's their hobbies. You know, painting is great. The other thing is golfing. A lot of people have difficulty putting the ball down, and for them, it's life-changing.
Yeah. All right. Well, if you have any questions for our doctors today, go ahead and get those in to YouTube or Facebook. There on the chat. You can tweet us or email us at the Medical News Network. The info is right there on your screen. Let's get a quick check on our COVID count. Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. How are you? Good morning.
Hi, good. Yeah, still staying in those single digits for the active cases. We have 19 total cases, 6 active, but unfortunately 1 in the ICU and is on the ventilator as well. So 1 case of severe disease at this point in time.
All right, Doc Hawk, thank you so much.
Yeah.
Earlier this month, an important study found a strong link between Parkinson's disease and a certain chemical called TCE. The study, published in JAMA Neurology, looked at medical records of tens of thousands of veterans. The Marine Corps base Camp Lejeune in North Carolina is where the water was found to be contaminated with TCE. I'm sure you've seen that everywhere on television. The study showed that veterans who trained at Camp Lejeune had a 70% higher risk of developing Parkinson's compared to other veterans. Dr. Pawa, you are a Parkinson's expert. This is not the first study to link TCE to Parkinson's, but why is this particular study so important? What's it telling us?
So the thing is, we know that herbicides and pesticides, which are chemicals, can increase the risk of Parkinson's disease. We have known that for over 30 years. Over the last few years, we have looked closely at certain other chemicals and also found links between certain industrial chemicals as well as increasing the risk of Parkinson's disease. This study was done at an Army base where there were a group of patients or actually veterans who lived there and drank the same water and had the same environment for it. And a large number of them developed Parkinson's disease. So that was the basis of it in trying to find out what increased their risk of Parkinson's disease. And it was found that TCE, which is a chemical used for cleaning some of the tanks, did go into the soil and did affect the water, and that's most likely where it developed it. The challenges, of course, come down to is why did not everyone who had that water develop Parkinson's disease? And there's always a genetic link. There have to be some genes with the interaction with the chemicals resulting in Parkinson's. As you know, a year ago we also had another chemical which is used in the dry cleaning industry, which also increased the risk of Parkinson's disease. So we are learning more and more about the certain chemicals that are increasing the risk of Parkinson's disease. But fortunately, a lot of these chemicals are not being used today. And hopefully in the future, we'll be having fewer chemicals that actually cause some of these neurological diseases.
So that means you think we'll see a drop eventually, but a slow drop, because we're now seeing those delayed effects.
Right. So some of that, yes, we will see if it's related to certain chemicals. But on the other hand, we also have to remember we are an aging population. We are living longer, and Parkinson's disease does affect older people. So definitely it might end up balancing it on how many people have Parkinson's.
Do we have any reporters with us today? We do not, so let's get to our community questions. And Lynn wants to know, does insurance cover this procedure? What's the cost to a patient?
Yeah, so Medicare does cover it, and some Medicare replacement plans do cover it. We've had some luck, and there are some Medicare replacement plans that we've had to write letters or do some discussions with them, and eventually they did cover. But it's really Medicare that does it. Some commercial payers will pay for it, but it's something that would be important for patients, and our team also looks at that prior to putting someone through this process.
As we heard in Carlene's case, she had some after effects like balance, but Paula wants to know, are there any risks to the procedure itself?
Yeah, so the main risks associated with it are the balance difficulties. Some patients can have a little bit of speech deficits afterwards, some numbness, typically in the fingers, at the tips of the fingers. The thumb for some is a common place around the lips. But I guess there's a theoretical risk of bleeding or stroke, but ultimately those are very, very, very low, way less than 1% chance of any of those really bad complications. And it's important to know that the gait and the numbness, all those pretty much resolve in the vast majority of patients.
Yen wants to know, Dr.
And I want to point out one thing. When these lesions are created, we can see most of the side effects while before the lesion is created. So if someone has a little bit of numbness, etc., but we cannot check the gait and balance because they're lying on a table, and that's one of the challenges. Is we often find that later on.
Catherine wants to know, is focused ultrasound beneficial for both essential tremor and Parkinson's tremor? Is it a permanent fix?
Well, we do know that there are certain patients in whom the tremor can get worse over time. Because tremor is getting worse, when you create the lesion, it's like having a scar tissue, and at times the scar tissue does get smaller, so to speak. And there are some patients who have had gone in for another lesion on the same side.
So tell people the difference, though, between tremors. Are tremors and Alzheimer's tremors a different type? Tell people the just different degrees of what they could experience.
Right. So the most common tremor is essential tremor. The other one that is approved for is Parkinson's tremor. So essential tremor mainly affects people when they're doing activities, like she said, painting, eating, writing. Majority of the cases of Parkinson's tremor have tremor when they're just resting. Their hand is on a table or something. When they actually try to do stuff, the tremor gets better. However, there are some Parkinson's tremor patients, when they're trying to do stuff, the tremor does affect their activities, and those would be patients who would be candidates for also focused ultrasound.
Dr. Kinsman, Terry wants to know, can focused ultrasound be used to treat different conditions?
Yeah, so the same company that makes the focused ultrasound system we have also have basically a body version of it. So it's approved for use with prostate cancer, uterine fibroids, as well as for palliative treatment in patients with bony metastases. So we don't have that system, but it is something that is a possibility.
Jeremy wants to know, are there any types of tremors or neurological issues that are more or less responsive to this type of therapy?
So, of course, essential tremor is the one that is very effective. We have used that, and you saw the patient. In fact, over 90% of the patients are very satisfied having this procedure. Parkinson's tremor also, we have seen a patient respond very well. One of the challenges before doing this procedure is the bone thickness, and I'll let Dr. Kinsman talk about that.
Yeah, so before we see the patient, we talk to them, they want to proceed. We always get a special CAT scan of the head. What that does is it gives us what we call an SDR value. So what that is it's a kind of complicated calculation of that involves thickness of the bone and shape of the head, and ultimately gives us a number that lets us know how efficient, how well we're going to have, or we're going to be able to have those sound waves penetrate to the spot where we want. If it's, so 0.45 is kind of a number that so anything higher than that is considered normal, but about 10 to 15% of patients will have a value a little bit less than that, which what that means is it's going to be a harder treatment. We can do it in most cases, but it's a little bit more challenging to perform.
Aaron wants to know, are essential tremors hereditary, the way that Parkinson's would be?
Right. So actually, essential tremors are much more hereditary than Parkinson's. We talk about in essential tremor, anywhere from 50 to 80% of the patients have a history of essential tremor. In Parkinson's, we are looking at more at 10 to 15%. So pretty much one of the other questions, other than how well alcohol helps their tremor, is anyone in the family has tremor, is another one that we look for when we evaluate patients with essential tremors.
As we get ready to wrap up today, I want to get today's takeaway. Dr. Kinsman, I'll start with you. What do you want folks to know?
Yeah, so I think the main takeaway is that focused ultrasound is safe, it's effective, and a very good option when it comes to treating essential tremor.
Dr. Pawa, what's the takeaway?
Yeah. So right now, these procedures are still for patients who continue to have tremors after being on certain medications. So the thing is that they cannot come without having tried any medications and looking to get this procedure done. The second thing is their tremors should affect them on their daily activities. So whether it is eating, drinking, riding. So if they have a little bit of tremor and it doesn't affect them on a daily life, then again, we want to hold off on having this procedure.
Gentlemen, thank you so much for being here with us today. We want to highlight National Stop the Bleed Day. If someone is seriously hurt, knowing how to control bleeding could really save their life. Here's Ellen Van Zant alongside one of our nurses.
Well, we all know CPR is a life-saving skill many people can perform, but there are also some other things we can learn how to do ourselves that might save a life. Knowing how to stop the bleed is one of them. When someone might be losing blood from a cut or even a gunshot or some other injury. We have Israel Mendoza here today. He's a trauma education specialist. He's here to help us understand. Thank you for being here today.
Thank you for having me.
So stop the bleed. That is the key to saving lives.
That is.
There is a right way to do it.
There is a right way to do it. And we teach people 3 basic skills on how to do it during the class.
Mm-hmm. Let's start with number 1.
Yeah, so the first one is putting pressure.
Okay.
Pressure on a wound.
We see in the movies, whether someone gets shot or something else, that they're always putting pressure on the wound. But are they doing it right?
A lot of them show an appropriate way, but there is definitely a more appropriate method of doing it.
Let's learn the best way right now.
Yes.
Okay, we've got a little dummy right here with an injury.
Yes, quite an injury here. And throwing it back to CPR, the way that I like to show it is you perform one life-saving compression to a person. You put your entire body weight on that wound, and then you stay there, and you do not move until help arrives.
So while we learn CPR, we learn about the 15 short compressions. This is just one big compression, everything you got.
Yes, everything you have.
All right, so you would get on like this. You'd put a hand on top.
Put your other hand, put your entire body weight, and then you would stay there. And I also tell people, no peeking. You want to stay there until help arrives.
So I can't look. I can't be looking around. Got to be keep focused on this.
You can't move your hands. You can't peek to see, you make sure that it stopped.
Okay, so that's one way to do it.
That's one way to do it.
Say there's a worse injury, and we hear of tourniquets also. We see them fastening tourniquets with belts and with sheets in the movies. That's probably not the most appropriate way of doing it.
And so that is one thing that we teach people that is not the best way to do it. While you can use a sheet or a towel to provide compression, we really encourage people to use approved tourniquets for stopping the bleed, as these have been specially made so that they are tight and stop.
And so this is one of those approved tourniquets. It looks like just a little fastener here. It's a pretty simple thing to do. And if you have one of these, then how do you apply a tourniquet?
So we teach you in class the proper ways to go through this. Usually takes less than 10 seconds to apply this, and in less than 10 seconds you can save someone's life from bleeding out.
You'd mentioned a third way as well.
The third way would be include packing with compression. If you notice that the wound is fairly deep, you can always pack it with whatever you have. Not everyone has commercial gauze available, but you can use a t-shirt, towels, anything that you have that might be porous.
And you can learn more about that in your Stop the Bleeding classes that you have.
Yes, you sure can. And so we have scheduled Stop the Bleed courses here at the KU campus. You can check out more information at stopthebleed.org, which tells you more about what the mission is and what this program is all about. You can also find more classes that we host here at KU, but you can also use the QR code on the screen to schedule a course. I go out to anywhere out in the metro of Kansas City, and small groups, big groups, happy to teach anyone.
Have tourniquet will travel.
Yes.
All right. Now, who would these classes be good for?
So these classes are good for anyone that is wanting to learn a life-saving skill. Trauma is the #1 cause of death and preventable death in anyone ages 1 to 44 nationwide. And bleeding is the #1 cause of preventable death in any injury.
Well, let's check out that QR code, get signed up for a Stop the Bleed class. Israel Mendoza, thank you for being with us today.
Yes, no problem. Thank you for having me.
Alan, Israel, thank you so much. All Things Heart is coming up here at 10 a.m. Today, we meet a young woman whose heart problems began just weeks after her birth.
I was 19 days old when I had my first heart procedure.
Nearly 30 years later, she dismissed the warning signs that trouble was brewing in her heart once again. You'll hear about the groundbreaking procedure that fixed her heart and had her back to work within weeks. Join us at 10 a.m. for all things heart. For now, thanks so much for being with us here. Have a great day. Coming up tomorrow on the Morning Medical Update, Alex Treaster is glad he listened to his wife and didn't power through his stomach pain. The 37-year-old learned he had a tumor in his colon. I'm Jessica Lovell. On the next Morning Medical Update, meet a young dad developing deeper connections with friends, family, and his medical team during his cancer journey. Friday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.